This is the second video of 5 that are discussing individual branches of the brachial plexus. So this time we're talking about the median nerve. Let's review what we already know about the median nerve, and then we'll take a look at some of the images and talk about function that this big nerve needs to fulfill. Median nerve, as we know, is the byproduct of two cords, lateral and medial cords. They have to give their fibers in order to assemble a large nerve which carries C5, 6, 7, 8, and T1 fibers. That is the median nerve. Interestingly enough, as big as it is, it doesn't have much of a role within the arm. Interesting part of the arm is that the nerve itself is found within the medial bicipital groove. So I would just put my arm in front of the camera, and on the medial side where you find the biceps, there is a little bit of indentation inferior to the biceps. So exploring this area, firstly you would be noticing pulse of the brachial artery. That's number one. And when you move your fingers very gently up and down, you would be able to feel two cord-like structures that are running next to brachial artery. One of them is the ulnar nerve, one of them is median nerve. So that is the medial bicipital groove of the arm where we're finding it. Once it has passed the arm, it is now trying to get somewhere deeper and a little bit more close to muscles it needs to innervate, because keep in mind, in the anterior forearm, the median nerve innervates 6.5 muscles. So superficial layer, pronator teres, flexor carpi radialis, palmaris longus. Then the second layer, flexor digitorum superficialis. Then in the third layer, it innervates flexor pollicis longus and the lateral half of flexor digitorum profundus, the one which produces tendons that add movement to distal interphalangeal joint of index and middle finger. And at that point, it is waiting for its probably most interesting task. It has to pass through the carpal tunnel, and once it runs through the carpal tunnel, and if it escapes out of it unharmed, then the little bit of extra work is still expected to innervate some of the intrinsic muscles of the hand. We call them loaf muscles, and loaf muscles are mostly creating this huge elevation on the lateral side of the palm that we call the thenar eminence. If you start actively moving your own thumb and use thenar muscles, you can identify abductor pollicis brevis, and you can feel its contraction practically on the lateral side of first metacarpal bone. Flexor pollicis is more positioned within the palm, and deep to flexor pollicis there is opponens pollicis that is going to facilitate and to iron out smooth carrying of the opposition movement. That is O, A, and F, opponents, abductor pollicis brevis, and last one, of course, flexor pollicis brevis, whereas the letter L stands for two lateral lumbrical muscles in the central compartment of the hand. The lumbrical muscles are interesting because their tendons are becoming part of the extensor hood. Because the lumbrical muscles are coming from inside the palm, originally, in order to join the extensor hood, their tendons must pass anterior to metacarpophalangeal joint. Therefore, they will be acting to flex the finger at metacarpophalangeal joint. I'm sorry, my thumb is getting into camera. I just want to use my index finger. But as metacarpophalangeal joint is flexed, then contraction of the same lumbrical muscle is now transmitted on the dorsal aspect of proximal and distal interphalangeal joints, and as such basically finger remains straight. Interphalangeal joints are both extended while flexion has been applied to metacarpophalangeal joint. So these are loaf muscles, two lateral lumbricals, opponents, abductor pollicis longus, abductor pollicis brevis, flexor pollicis brevis, and then it comes to sensory innervation that the median nerve is providing. I suggest we take a look at the Netter's image and discuss the sensory innervation on that particular image, which really nicely illustrates what is going on. I will just need to position camera to capture maybe the lower part of the screen, but you know what? Let's also see it from the top. Here is the brachial plexus, the infamous M, and from the middle of the M comes the median nerve. You notice there are no branches. This is the medial bicipital groove where the nerve is found. And then, as we're approaching the elbow, median nerve starts giving peripheral fibers that are adding innervation to anterior forearm muscles, as we have just indicated. So everything exceptions are flexor carpi ulnaris and flexor digitorum profundus muscle, with part of it that makes tendons for ring and little finger. Interesting within the elbow, and perhaps I can just zoom it in a little bit to make sure that this is quite nicely visible. Median nerve wants to run deep. It doesn't like the idea of staying on the surface because it could be more frequently injured. Therefore, it dives deep to this arc-shaped tendon of flexor digitorum superficialis. This muscle has been also cut and its proximal part has been everted upward. So we have a bit of continuity between main trunk of the median nerve passing deep to flexor digitorum superficialis, and we see it here as it continues practically very close to tendons of flexor digitorum profundus. At the wrist, which we're going to see in a moment, I will still keep the same zoom level so that we can really see everything together. This is where the nerve runs through the carpal tunnel. Normally it should be fine situation, but any kind of tenosynovitis, inflammation of tendons in their tendon sheath may reduce the space available, and the structure that will be paying the highest price for it is, of course, the median nerve. Within the hand, it innervates loaf muscles, all of them being present here, while the rest of it actually becomes interesting part of its sensory innervation. So on the right side of the screen, you and I can see quite directly as what the sensory pattern really looks like. The nerve innervates anterior palm, not in its entirety, but it goes practically on the lateral side of it, and then produces cutaneous branches that are covering the thumb, index finger, middle finger, and something quite unique again, it is the radial or the lateral side of the ring finger. The remaining part of the hand, ulnar or medial side of the ring finger, little finger, and rest of the palm, are innervated by ulnar nerve. On the dorsal side of the hand, you realize that the median nerve actually also goes onto the dorsal aspect of at least distal phalanges, and it covers sensation of the thumb, index finger, middle finger, and also the radial or lateral half of the ring finger. So, with median nerve being described anatomically, we're now to say just a few extra words about one of the common situations that is called the carpal tunnel. Carpal tunnel is a condition which let's say 30, 40 years ago, was common, but not as common as it was towards the end of 20th century. And this is the device for which we actually blame increased number of cases, the infamous computer mouse. So while holding the mouse and while browsing the net, you and I will be doing literally hundreds of same repetitive movements using one or eventually two fingers. That is creating a situation where tendon of index finger, which is most predominantly used, may start rubbing itself against other tendons that are passing through the carpal tunnel. And that is the rationale for explaining as even very light but repetitive movement may lead to carpal tunnel. People who operate some heavy tools, machinery, especially the ones that are producing significant vibration, people who are operating jackhammers, or even people who, for fun, operate the small craft with the outboard engine, and of course they keep their hand on the throttle all the time together with adding or reducing the throttle. They navigate directly by manipulating the motor. It is also resulting in some kind of unpleasantness, and maybe for one single episode of boating on the lake might result in some kind of unpleasant pins and needles or tingling sensation, but again in these three and half of the ring finger. So when things are obviously running in the direction of carpal tunnel syndrome, it could be due to displaced, pushed into the carpal tunnel, some of the carpal bones, the lunate might be one of them, with some kind of accidental fall onto posterior aspect of the wrist. Lunate bone could be displaced into carpal tunnel. I would not elaborate here about any kind of treatments. People have, first of all, their own health providers to discuss their situation. However, the treatment varies from change in the lifestyle, do not use the computer as much as you did, to eventually some kind of application, hot and cold, or maybe just some additional conservative form of therapy. However, it may require also to try to treat the carpal tunnel with anti-inflammatory drugs, injection of corticosteroids, possibly sometimes directly into carpal tunnel, including, of course, the one which would be pretty much the last resort, and that is the surgical decompression of the median nerve, basically requiring surgeon to cut through the transverse carpal tunnel and to make a little bit more space within the carpal tunnel. If median nerve is damaged, and any nerve could be damaged in any possible way, so you just have to think about a variety of different accidents, any kind of penetrating wound on the medial side of the arm, or penetrating wound on the anterior side, or some kind of really very awkward and not everyday type of fractures could affect the median nerve. And as such, if the median nerve is involved, it could be also due to neglected carpal tunnel. Basically, deformity that comes apparent later on is called the ape hand deformity. I'll put my hand under the secondary camera, and I will again do the same, trying to mock what the ape hand deformity really looks like. Normally, the thumb would be positioned practically being rotated by 90 degrees relative to other four digits. But if I try to push my hand hard against a flat surface, the thumb looks like it has been positioned practically in the same plane with other four fingers. Main result or main cause for this is significant atrophy that could affect muscles of the thenar, so practically with opponent's abductor and short flexor going into atrophy. It will affect not just mobility of the thumb, but it could also result in its somewhat awkward and unnatural, anatomically unnatural position, hence the ape and deformity is the term that we're using to define this kind of change, which is usually something for which we need to allow some time to lapse in order for atrophic changes to become apparent and visible. I hope that you enjoyed this presentation of median nerve. We're going next with another nerve of the brachial plexus. So thank you for watching this one, Anatomy Made Simple by Dr. T.